Hello and welcome to another edition of Health Matters. My name is Anna Marie Sinatra, and yes, this is still a crossover show with Ava San Marco from Health Focus. Together we bring you Focus on Health Matters. We're disappointed Ava couldn't be here with us today, but I am still so excited. I am here at Bennett Health and Wellness Facility, where you know he is one of our corporate sponsors, and he has brought us so many wonderful programs when giving you good information on how to live a healthy lifestyle, how to make good choices with food and vitamins and minerals and your health care. And I am so excited because we have a very special guest. So make sure you get those pens and papers ready because we're going to give you lots of good information today. Before we get started, I want to give a special thank you to Dr. Frank Mascaro from Western New York Imaging Associates, where he has the diagnostic imaging equipment that when you are in the time of need, you can call him and make an appointment and get awesome imaging so you can find out and get to the bottom of your health issue. And we just thank him for his continued support to this Western New York area. And we also want to thank Kim from Mr. Frank's Day Spa, where she's working hard to keep me beautiful with hair and pedicures. Remember, she does that medical pedicure, and I have been enjoying that too for various reasons. So if you've got a few little issues with your feet and you're not ready to go to a podiatrist yet, go get yourself a medical pedicure or go get yourself some good hair color from Italy, and see if she can make you beautiful too. And we also want to thank Marge Reed from the Healing Spa, where she's using different techniques to help firm up your skin and get rid of those wrinkles. I think we kind of call them a non-surgical facelift. So give her a call too and make sure you tell her that you heard it on Health Matters. And you can let me know too if I'm doing a good job in keeping my skin together. So I'm watching every day what I put on my skin, what I put into my body. And this is really important, folks, because we know that the information is power. That when we take that power and put it into action, we can have a healthier lifestyle. We could make better choices. Stop drinking soda, drink more water, start choosing more whole foods rather than those packaged foods. Be careful of what we put on our bodies too, and what we spray in our hair, and what we're washing our hair with. All this stuff matters. You know, when you're in the shower and that hot water is hitting your body and your pores are opened up, if you're using perfumes, soaps, and soaps that have chemicals in them, that stuff is going right into your body. But don't be too worried, because we've got somebody here who's going to tell you how you can get rid of the toxins in your body. So start to make better choices. Start to notice when you go to the grocery store, when you shop the perimeter of that store and you look for fruits and vegetables, organic, and lots of good ideas. Just get those pens and papers ready, take some notes, email me and let me know that one step that you're starting with today. And here we are once again with Dr. Bennett. Thank you so much, Dr. Bennett, once again for supporting this show and for making such an amazing contribution to the community.
My pleasure. We have a very special show today.
I know. This is really exciting. It's like, is there anybody who's not amazing that you don't have here with you?
That's right. I'm very excited today. It shows.
Yes, absolutely. You want to tell who we have with us here today?
You go ahead.
We have Dr. Barnes here with us today, which is absolutely so amazing, folks. So make sure you have those pens and papers ready, because you are going to get information that is going to help you so much in your quest for good health. This is so exciting. Dr. Barnes is now partnering with you as well. And he also still has his own practice over on Walden Avenue near the Galleria, and is going to be sharing some great information and some services right here at Bennett Health and Wellness. And welcome, Dr. Barnes.
Thank you very much. It's certainly nice to be here.
It is, because Dr. Barnes is no stranger to me either. So there's just not any words. I keep telling you that I'm lost for words when I'm here, because this is just so amazing. So,
Yeah, we've gone back quite a few years now.
Yes,
At
we
least
have.
5.
I think it's a little bit more, but we'll stick with 5. That sounds good to me.
That does to me too.
So tell us a little bit about what you do, because you are a medical doctor, and you have been in the holistic field for
17 years now. I was a general surgeon for 30 years before I found out something about health, and I found out about chelation therapy and started a practice with practicing especially chelation therapy. We've expanded that into the holistic therapies, including ozone therapy, hydrogen peroxide therapy, IV vitamins and minerals, as well as high-dose vitamin C, and things that are very positive for the body to help the body get back into a healthy state.
Now, I know the people are watching now say, what did you just say? So let's break it down a little bit for them. You hear Dr. Bennett and I always talking about how important it is what we're putting in our bodies and on our bodies. And, we could do so much with diet, with exercise, but our bodies are pretty toxic, I'm understanding.
They are toxic, and most of it depends on how we're eating and what we're eating. And of course, most of our food is grown on soil that is deplete in nutrients. Also, we put a lot of sprays on the food, which are toxic to the body. So probably the best thing that we can do for our general health is eat organic. Then we always can't do that, especially in the Western New York area. So chelation therapy comes in, and chelation traditionally has been an IV injection of a synthetic protein. What it does, it takes toxic heavy metals out of the body, such as mercury, lead, arsenic, cadmium, and about 20 others. It also takes calcium, magnesium, and some good things out that we replace every day with nutrition and with our food. Taking calcium out, people will get shocked at that, but if you take calcium out of areas where it shouldn't be, we call that arthritis, or we call that plaque and vessels. So as you take the calcium out of those areas, the body can improve.
Wow, that's amazing. That's great information. So now people come in, and you're doing this. You have an office out on Walden Avenue near the Galleria Mall, and you're also doing it now here at the Bennett Health and Wellness Center.
Well, the Bennett Health and Wellness Center has their own devices and the things that they do, and they do everything that I do. Except at a different location, of course. But yes, I'm down on Walden Avenue, and we've been there for 5 years at this point. As I said, I've been in practice 17 years, beginning in Fredonia, New York.
That's quite amazing. And I remember you used to be out in the South Towns by me, too, because I used to be a client of, or patient of Dr. Barnes as well, and experienced some great health. I used to suffer from sinus infections all the time, and when I was chelated, I no longer had that issue.
Well, we use chelation for all types of things to help improve the health, but for sinus conditions especially, we get into hydrogen peroxide, which, as I remember, you had, and or ozone. Ozone is oxygen to the third power, and free oxygen radicals kill off pathogens, which are virus, bacteria, and fungus, and cancer does not grow on oxygenated tissue. So there's a lot of benefits, and it also stimulates the immune system to help us become healthier and get rid of toxins within the system.
So for people who are watching today, what would you say, both of you, to encourage them to where people start? They're hearing about this for the first time. They get in touch with you. You talk with them. I mean, how does someone start?
There's different books to read. Bypassing Bypasses about chelation therapy is a good book. There's also a book called 40-something Forever that you can get on Amazon.com.
I like that 40-something forever. That works for me. Does that work for you?
Oh, yeah, absolutely. I'm only 30, by the way.
Well, okay. I'm not going to go that stretch.
Well, I'm the only one that's made it there, and I'm still 40 forever. So you two have a few years to go.
Thank you, but I don't know about that one.
Well,
we're not under oath here, right?
Okay. But as you start reading about chelation, there's other books. One's called Wellness Against All Odds, and that's written by Sherry Rogers, an MD out of Syracuse, New York. She's no longer in practice as of this last April, but she wrote about 8 or 10 books. So these are things that we can start in, learn about health, and then come to our clinics where we have consultations and we go over the health of the patient, the history and physical of the patient, and then make suggestions on what would be good for them, both nutritionally, dietary-wise, as well as intravenous-wise. There's nobody that cannot improve by utilizing chelation therapy and oxidative therapies, as well as vitamin C, I guess we could say that.
Absolutely. It only helps. Vitamin C is a phenomenal antioxidant, and as Dr. Barnes knows, that's absolutely, it's almost like a natural virus killer, bacterial killer, and adds to the free radicals. It's like a free radical killer. So all the buzzwords nowadays being free radicals causing cancer and other ill effects in the body, vitamin C completely reverses it. It's phenomenal. And also, while talking about certain things, Dr. Barnes also knows about macular degeneration. One of our biggest problems in our seniors nowadays is the amount of macular degeneration that goes on. And with chelation therapy, with high vitamin C, it's a phenomenal antioxidant that helps promote the healing of macular degeneration.
And what is macular degeneration? Because I know I'm probably getting close to learning about it.
Dr. Barnes, you want to take this one over?
Sure. Macular degeneration is a declining vision as you get older. And the macula is in the back of the eye, and as we age, we get arteriosclerosis and other things. We don't get the oxygen to the macula. With arteriosclerosis, you don't get the blood supplies, thus the oxygen as well as the nutrition decreases. And as you give ozone along with either vitamin C and or chelation therapy, you start increasing the blood supply. And I've been doing this for 12, 14 years now with the ozone, and not once did the macular degeneration increase. And most of the time, it will start reversing itself to the point where people who are legally blind can sometimes get back in and start driving again, because as you increase the blood supply into the eye recovers and the vision improves, of course.
That is amazing. Our bodies are pretty amazing that given the right food, exercise, and then some treatment, we could really be healthy.
Well, we're the most amazing mechanism. Getting into the internet is mind-boggling to me, but that doesn't hold a stick to the human body. And all recovery for disease comes through the body healing itself. As we know, as practicing conventional medicine for 30 years, we treat the symptoms of a problem and don't really treat the disease process itself. So we're managing disease, where what we're doing at this point is helping the body become healthy, which means reversing disease processes.
You know, I really like that you said it that way, because that's what this program is all about, and this is what's been so wonderful about partnering with you too, Dr. Bennett, that we're talking about a proactive lifestyle, one where we're trying to stop disease from coming, trying to live a healthy lifestyle. And it's not easy. Yeah, we have all those things out there. I know everybody struggles. We all do. But when we can be proactive and have the information at our fingertips, we have a better chance at it.
Absolutely. Again, at the beginning of the show here, we stated that nutrition is the very most essential aspect of getting healthy. And I hate to say this, but the old cliche, you are what you eat, is absolutely 100% correct.
But you know what? You know what I'm going to say next? I go that I'm very, very sweet. No, I've been trying to be a good girl. I've been trying to be a good girl.
I'm sure you are. But seriously, yeah, it's very important. It's very essential. And not only what you eat, but unfortunately in our society, what goes on top of what you eat. All the pesticides that we're using on top of the foods, it's absolutely horrible what they can do to the liver, which is one of our best antioxidants. What it does, it changes all the bad portions that are in our blood into a chemical that we can excrete from our GI tract and get rid of, detoxifies. It's a phenomenal detoxifier in our body, but we're feeding it all these toxic chemicals. And we're killing the one mechanism, one organ in our body that detoxifies us. So we have to go and help it by giving all these other antioxidants to help the liver rejuvenate.
And then Dr. Barnes reminded us of, I heard you mention, you educated me quite a few years ago, 4 or 5, about the soil that our food is grown in as well.
Yeah, the vegetables usually take out 15 to 20 or more minerals out of the soil, and we replace it with 4 to 5 minerals. So as we can see, as time goes on, we become deplete, and the vegetables, they don't taste the same way they did 50, 60 years ago, and they don't have the nutrients in them. And that's what we are. You know, God gave us food. He gave us food for one reason only. It wasn't to satisfy our appetites. It was to supply the cells of the body with proper nutrition so the cell could function at 100% rather than 50% capacity or whatever.
That is incredible. And we just use food for all kinds of things, not even thinking about that. It's actually food for our body, for healthy, good living.
Yeah, and anything that comes in a box, a can, or a wrapper has preservatives and all sorts of things in it, and probably lacks tremendously in the value of the vitamins and minerals.
And some of the larger stores too now are expanding their collection of, or what they're offering organically. So there's not as many excuses anymore. And we're always reminding people to shop the outer perimeter of the grocery store when you go, because everything on the inside is processed.
Absolutely.
Yeah, see, I'm learning too.
There's not too many aisles, and in fact, there's probably about a quarter of an aisle of good food in the whole grocery store.
Oh, wow.
And all the things that look good and taste good but aren't good for us. You know, when do we start getting toxic? Toxins start coming into our body, especially heavy metals such as mercury, before birth. You know, in utero, the mother who has mercury in her system because of amalgam fillings, which are metal fillings, mercury spewing out of our factories that gets into the air and then into our body. All people do have mercury, that's transferred over to the baby. So when we're born, we have already a start of toxic metals in our body, such as mercury. So then as we get on Earth and get exposed to the air, there's other metals that come in with pesticides on the foods and all sorts of things. So I like to start, you know, who's my favorite patient? A favorite patient is somebody who comes in that's 70 years old, has chest pain walking in, because probably after 4 or 5 treatments, they're going to be walking a mile or 2 without chest pain because they're improving.
And don't people come to you from all over the world?
Oh, as a matter of fact, I did have somebody from South America, but most of them are from the area, and people do come from outside. But getting things going and getting toxins out of the body helps the body there again improve.
I believe that when I first learned about mercury, and we're talking about the amalgam fillings, those silver fillings in your mouth are extremely toxic. I don't know what happened, why they didn't know about that before they started using it. But that's what first brought me to Dr. Barnes. And I was glad, too, because so many of my friends were getting everything out at once. And he said, oh, that could be dangerous, too, because of all the toxins that get into your... When you take them out, you have to make sure you do it in an appropriate setting as well. Right. And then I followed through with the treatments to make sure that it all came out of me.
Yeah, and actually, it takes a long time to get everything out of you.
I think that means I need to start getting busy again.
Well, we never get down to zero, but the more toxins we get out, we allow the cells of the body to function better, and thus our health improves.
And people, I'm thinking about how I get real busy and don't follow through with some of the things, because I was coming to you for a couple of years, and we can't do everything right all the time, but we have to start somewhere, and that's what this show's all about, to give you the information so that information is power only if you act on it. So beginning to act on something, starting somewhere, get proactive and responsible for what we're putting in our bodies. So how could people start today, even if before they pick up that phone, because they're going to pick up the phone and call Bennett Health and Wellness and you and find out more, well, what else can they do right now today?
They can evaluate what they're eating and look in their cupboards and see how many canned foods, packaged foods there are, and see what they can do about starting slowly buying organic fruits and vegetables and getting that going, so that their body has something to work on to get back toward a healthy state.
Oh, that's good. That's good. Dr. Bennett.
Absolutely. And what I usually, every show I usually give a little tidbit.
That's right. Okay. I usually squeeze out more than one or two. I'm working for y'all.
Today, let me give you a little bit of tidbit, one more. It's, again, nutrition with vitamin C. Every time you want to detoxify, one of the best ways is to exercise. Exercise enhances it. One way the vitamin C helps is that by taking vitamin C an hour to two before each exercise, 1 to 2 grams before exercise, helps almost neutralize the free radicals that you create. The problem with exercise is that it uses a lot of vitamin C during exercise because it's a phenomenal antioxidant. And while you're depleting yourself from vitamin C, it robs all the other tissues to be able to utilize its antioxidant effect. So if you can take 1 to 2 grams before you exercise, you won't deplete yourself from vitamin C. So it enhances not only your antioxidant ability in your body, but also destruction of free radicals. Destruction of free radicals means less wrinkles, decreased ability of getting cancer, and ability for you to be healthier.
Wow, I like all three of those. How about another one? One more.
A little later.
I'm going to keep working on it. And you do some vitamin C treatments as well, right?
Yes, we do. But one thing about vitamin C is that we're one of the few primates on Earth that don't produce vitamin C. Chimpanzees, monkeys, humans, and a bat over in India. Now, I don't know how they got that information, don't produce vitamin C. But elephants, dogs, cats, and everybody else does. So if they get under stress, they produce it. We don't produce it, so we have to take it by mouth every day. So as Dr. Bennett was saying, it's a very essential thing, especially for exercise, but on a daily basis. If you have a 1 or 2 year old at home, you should be taking vitamin C a couple times a day. And as we get to be our age, 2 to 4 grams twice a day would be a good amount for us.
Now, you both are talking about grams, and I'm getting a little confused. You might be confused, too. It says like the bottle is like a 500 or 1,000.
1,000 is correct. 1,000 milligrams is 1 gram.
Oh, okay.
500 milligrams is half of a gram. So you want to take 2 of those 500s or 4 of those 500s. Okay. Now, when you want to take vitamin C during the day, here's another tidbit. It's your body does not have the ability to uptake vitamin C all at once. It only uptakes maximum of 27% if you take 10 grams of vitamin C at once or you take 2 grams of vitamin C at once. The best uptake of vitamin C is 1 gram at a time, about 3 or 4 hours apart.
Oh, So 1,000 milligrams. When you say gram, it's 1,000 milligrams 3 or 4 times a day. That's like for average?
Up to 10 times a day, yeah.
Up to 10 times a day.
Absolutely.
Ah.
Absolutely.
I usually do that just if I'm starting to feel like I'm getting sick. I didn't know I could take that much. So you need to call these guys so that you know what the best ones to take too, because I know there's a little something about that too. I remember when I was seeing Dr. Barnes, I was using a powdered vitamin C. We won't talk about anything specific here. It gives you a little hint. You better give them a call and figure this all out.
Yeah, powdered vitamin C's can be good if they're ascorbate, if they're buffered. If they're not buffered, they seem to go through the body faster than you would like.
Now, we're winding down. I can't believe this happens all the time. You absolutely have to come back again. But we have just a few more minutes left. What haven't we covered that you want to make sure gets in here today?
Well, I want to make sure everyone understands that at both facilities, we provide ozone therapy, vitamin C therapy, IV vitamin C, IV vitamins and minerals such as Myers cocktail, and other modalities. So if you ever need any advice, please call Dr. Barnes' facility and my facility. We'd be more than happy to consult everyone regarding their IV treatments or any kind of treatment that they provide.
And hopefully you call before you get sick. But they are treating people with heart disease and cancer and all kinds of miraculous healings and getting better by utilizing some of these protocols.
We are, by stimulating the body, especially in oxygen production, to get rid of pathogens, virus, bacteria, fungus, as well as help the body in general, the immune system function better so that we can attain the health that we should have.
That's amazing. Amazing. Well, you heard it, folks. I am just, again, so grateful. And you just have to know we've got some diamonds in the rough. We've got some diamonds in Western New York. And Dr. Bennett is just so amazing for me to be sitting between Dr. Bennett and Dr. Barnes, 2 medical doctors that know that it's really important to treat your body holistically and to do some preventative medicine before you have to get to the emergency part. So again, folks, you got the information. That information is power, but it's only power if you put it into action. So email me, call me, let me know that you called Dr. Bennett and made an appointment to see him. Remember, he takes all major insurances as well. And call Dr. Barnes and ask some questions. Get on the computer. Research, read, do something today. Remember, and if you're just starting off, what I always say, put down that soda and pick up that glass of water. So until next time, remember, your health matters.